All right, everybody, so today we're going to be talking to you about how to perform the Finkelstein's test. Super hard to say, but super easy to do. Positive Finkelstein's test is going to be indicative of de Quervain's Tenosynovitis. Kind of hard to say, super easy condition to treat. This is for our first dorsal compartment. Our two tendons that are involved are going to be our abductor pollicis longus and extensor pollicis brevis. What we're going to have our patient do is flex that thumb all the way down. We're going to grip that thumb with our other fingers, and we're going to ulnar deviate that hand. So again, we don't need to tell our patient that this is called a Finkelstein's test or ask them to spell them or do it in a word search or anything like that. But what we're going to have you do, Brian, I'm going to hold you out your hand, thumb all the way down, grab that thumb, and you point it that way. Perfect. So great example of a negative Finkelstein's test as he isn't shedding any tears. So we just saw a great example of a negative Finkelstein's test. So what would a positive Finkelstein's test look like, and what would we do with that information? Our positive Finkelstein's test is going to be notable pain and irritation in that site with that motion. Well, what does that really mean to us? Again, we're talking about these two tendons, abductor pollicis longus, extensor pollicis brevis. Mildly positive Finkelstein's, a little bit of pain, a little bit of irritation with that motion. Maybe we're talking about a little bit of tendinopathy, some de Quervain's tenosynovitis, right? If we have a significantly positive Finkelstein's test, severe pain, severe issues when we're doing that motion, are we maybe starting to think about a little bit of partial thickness or maybe some interstitial or full thickness tears of these two tendons? Very important for that diagnosis of de Quervain's tenosynovitis. Super easy test, but super beneficial for your clinical evaluation. Thanks, everybody.